With cold and flu season approaching, it's important to sort out what is recommended for our most vulnerable population.
Joining us now in this sponsored interview is Dr. Sean Esplin. He is the Senior Medical Director for Women's Health at Intermountain Health. Happy holidays.
Thank you. Happy holidays. Thanks for having me.
All right, speaking of the holidays, how are we doing? We're not starting cold and flu season. We are smack dab in the middle of it.
We are in it, and we're seeing people coming in who are sick with the cold, with flu and COVID.
A lot of people coming in. How's Utah doing?
You know, it's better than previous years, but we are seeing an increase in people who are being admitted to the hospital. So it's important to take the precautions now, especially this time of year.
Well, and it does feel like everyone's sick this time of year, and there are people that are extra worried who are in those vulnerable populations. Talk about people who maybe are expecting a baby and what they should prepare for.
You know, it turns out that pregnancy is a really important time to be careful because both the flu and COVID are worse in pregnant women. So they have a more complicated course, more likely to get sicker, need to be hospitalized, and you want to make sure that you're taking good care of that unborn baby. So it's really important for this population to be careful.
Dr. Esplin, I think this is so interesting because while I was pregnant, I was told so many things to avoid. Immunizations are not one of those things.
No, absolutely not. This is actually a really important time to be vaccinated because you're protecting both yourself and your baby. So pregnant women should be getting at least 4 vaccines during their pregnancy.
Which are those?
The flu vaccine is important, the COVID vaccine, so get your booster for COVID. You get the diphtheria, tetanus, and pertussis, or the whooping cough, and then you also get a new one that's the respiratory syncytial virus. That's an important one because that's the most common reason that children are admitted to the hospital over this season is for the RSV. And now we have a vaccine that's available. If you get it in the end of your pregnancy, you protect this newborn baby for the first 3 months of life.
That I didn't know was that you are creating those antibodies for your baby.
Yeah, it's a great thing because your vaccination protects you and protects your baby. And you know, everybody wants to do what they can to make their baby's life the best as possible. And the truth is, a vaccination will protect both the mother and the baby.
Are moms getting these? And if not, are they concerned? Because I remember being pregnant and everything concerns you at that stage, right? You don't want to hurt the baby. Is that what you're hearing? Is I just don't think I should do this while I'm pregnant?
You know, it's hard because we're in a time where we're getting a lot of different kind of information out there. But the truth is moms are really being thoughtful about it. They're asking their doctors and their midwives really good questions. I mean, ask the people that you trust. You got to find a trusted source. And the truth is that the evidence is clear that the vaccines really help both mom and baby. So in the end, most people, when they hear from someone that they trust, they choose to be vaccinated.
Definitely something to keep in mind as well if you're going to visit a newborn baby as well.
Absolutely. You need to make sure that everyone that's coming in contact with the baby is protected. So we're encouraging those who are coming in contact to be vaccinated. And then taking precautions if you have illness, you know, making sure that you're not exposed to someone who's sick and washing your hands and doing the normal kind of hygiene things that reduce the risk of spread.
I love that you said that because I remember people coming in and grabbing the baby's hands. And you're like, that's the spot you don't want to grab if you are going to visit a newborn. Yeah. When in the pregnancy should you be getting the vaccination?
So you should get your flu and your COVID vaccine as soon as possible. Earlier you get it in the season, the better as far as being protected through the season. The diphtheria, tetanus, and pertussis, and the new RSV vaccine are usually at the end of the pregnancy. In fact, the RSV vaccine is after 32 weeks because you want to give some time for the mother to develop the antibodies that will cross through the placenta to the baby, and we want to do it at the end of the pregnancy because it's safer at that time.
Some good things to know, and also get your flu shot beforehand. How far beforehand when you're going to visit a newborn baby?
Usually 2 weeks or more before.
And you're excited, I know, about the RSV shot.
Yes.
Like, this is I've been hearing a lot of buzz about it.
Yes, it's great. It's a new thing that we haven't had before, and it's really going to, we think, make a difference to protect our babies.
All right, Dr. Esplin, if people have questions, what should they do?
You know, the best thing to do is to talk to your own doctor, your midwife, but you can also get information from national organizations like the CDC or the American College of Obstetrics and Gynecology.
Well, and intermountainhealth.org has such great information there as well. Everybody, please go to abc4.com/GTU, and we will put a link, and our thanks to Intermountain Health for this sponsored interview. Doctor, thank you for being here.
Thank you for